And action. Rich had a question about anxiety. More worry, but worry, anxiety, panic, it's all about the same. The idea is that the brain and the belief system that you go through sometimes changes. It'll change after a traumatic event. Something even if you're not involved in it, like 9/11. People watched 9/11 on TV and they became traumatized. A lot of the people in New York, and obviously the family members that were involved with 9/11, they certainly had their tangible reasons, but just watching TV, you would think, why would that do anything? But it sometimes is enough of a trigger that it changes around our belief system, and suddenly things aren't like they're supposed to be. Usually you have an event, you witness an event, and your body processes it, your mind processes it, and you deal with it. You say, either intellectualizing, you'll say, well, that's fine, it's a horror movie, it's not going to happen to me. Or if I drive safely, I should avoid the accident. Or if I stay indoors during a thunderstorm, I won't get hit by lightning. But sometimes when you have a change in your belief system, even your intellectual mind can't extinguish that weird thought. So it's like an abnormal thought for a normal occurrence. Sometimes with obsessive compulsive disorder, people have to keep on going back to the stove because they can't remember if they shut it off, and they're worried about shutting it off, and it makes them anxious. Sometimes with flying in a plane, people will become nervous even before they get on the plane. So giving a speech, people get worried. That's the belief system. And in many cases, if you're able to slow down that stress response, and just think backwards about why is this happening? Why am I feeling it? Why am I having these thoughts? It might get you away from that fight or flight response where you get anxious, you get sweaty, about to pass out in some cases. But sometimes that takes training. And if you try to count on the training or that technique right in the middle of a crisis, and you haven't been trained properly, you might fail. It might be too hard to bring yourself down. I think people who meditate, that's why I talk about cognitive behavioral therapy. Check out my video, DrRic Questions CBT, and you'll see what I'm talking about with cognitive behavioral therapy. One of the best treatment plans for anxiety or panic or worry is CBT. So you have to have a psychologist or a counselor or a social worker treat you and teach you that technique, though, and it takes a little bit of time. I mean, I always tell my patients, if you're supposed to train for a marathon or a competition with an organized sport and you have no coach, you have to read, you have to watch videos, you have to read books, you might get to that point where you excel in that competition or that sport, but it's faster and to get a coach or somebody that you can answer to teach you along the way and speed up your knowledge base. Same thing with CBT or mindful practice, relaxation practice, visualization, all that. If you can probably learn it on your own, but 9 times out of 10, life is too crazy, and the event or the anxiety reaction or the worry is 24/7, so it's too hard to learn that technique. I have a lot of patients that I say, you should probably practice meditation. Well, I can't sit for more than 2.5 minutes. And it's reasonable. When you're supposed to get to 30 minutes, 2.5 minutes, if that's all you can do, 30 minutes seems like it's a big mountain to climb. So sometimes if you have a coach in the form of a psychologist, you might be able to get to that mountain faster. So the idea is, if you can't do it on your own, you get a coach. If you can't do it on your own with a coach, then something might have to be added to your body, your blood, or your bloodstream, and that's in the form of either medicines or herbs. I always go with supplements first. I definitely change around diet. Taking alcohol or caffeine is too stimulating and too sedating, and that it is a drug itself, so it might be wiser to stop all that stuff. Doing exercise is definitely good, it's healthy, and getting on a bike or getting out and running, definitely healthy. But as a primary treatment plan for anxiety, especially if it always blossoms to panic, or if the anxiety or the worry is interruptive of activities of daily living or family gathering or family togetherness, the exercise might not be enough. I have patients who use exercise to calm down the mood. I think it's always appropriate, However, if we have to exercise like 6 hours a day to calm down persistent worry or anxiety, that's interruptive. Might have to decrease the time of the treatment plan or find another treatment plan to add on to the exercise. We have to have it appropriate for a 10-hour day and time spent with the family. I mean, we can't take you away from that. So it's always good to exercise, but if it's too intrusive to activities of daily living and family gatherings or family time, might have to find another way. So the shortcut with herbs is this. I have all my herbs here, but I'm just going to take you here instead of me holding up everything. These are a selection of different things. This is skullcap in extract form. I think it's wise to use as much as possible with non-medicinal first, and I think a lot of folks are off balance with regards to magnesium. I love Magmind. A little bit weak for me, but it does work for people who are deficient on magnesium. Skullcap is, again, an extract, and you can put it in a couple drops in a glass of water, take it 3 times a day with essentially no side effects. Ashwagandha, I think, is a very nice adaptogen, comes from a root, rebuilds the adrenals in many cases, but I think it also works to calm down. Rhodiola, kind of a stimulant if you have more anxiety and panic and fatigue, might work better than the ashwa. You can always do teas. Kava kava or calming teas are helpful, but they only give a fraction of what you're supposed to get. Don't forget, with omega-3, most of us are not eating properly, so omega-3 in our diet, very important. And something called inositol powder. Obviously, I like Now Foods. It's one of my favorite brands, but it's because I can find it locally at Fruitful Yield. So inositol is very nice at giving the body its building blocks for its neurotransmitters. So all this stuff usually is for calming down, or I should say supporting glands, whether it's the thyroid, the adrenal glands that sit on top of the kidneys, or the sexual glands. When you're in fight or flight all the time, they don't have opportunities to rebuild or function properly. So sometimes taking those supplements will help these glands work better. Getting a good night's sleep will help the body and mind rebuild overnight. And then exercise will help the body, number one, calm down that fight or flight response just for a short time, but it'll also help you feel better overall wellness. So all these things are helpful as a first line. But if you don't have any good improvement with that, then you go on to getting a coach, cognitive behavioral therapist, psychologist, and if that's even difficult to do, then we have to go to medicines. And medicines do work, but they do have their side effects. Effexor, Zoloft, Paxil, Prozac, Cymbalta, they're all great. You see the advertisements on TV, but they have the mild side effects. If you can use them as a temporary measure, great. If your anxiety or worry is really interruptive and you can't even leave the house, or you're starting to lose weight, you have to see a psychiatrist, because it's not just your primary care doctor who's supposed to prescribe. Sometimes the psychiatrist will be able to negotiate the crazy turmoil of different events, different times of the years, different symptoms, or piggyback diagnosis. Sometimes on top of a anxiety or panic attack, you'll also have a little bit of a behavioral issue, trauma from way back when that brings out problems. So I see a lot of my patients will self-medicate with alcohol or marijuana, which is okay to a certain degree. Marijuana for sure, alcohol no. But when you don't take care of the root cause, you'll find yourself escalating. I mean, one constant is that we all age. And as you age, other coping skills will fail for that decade of life, and it might not hold you. So it's always wise to go back and figure out the root cause of your problem so that you're ready for the changes that occur as you get to be 40, 50, 60, and 70. Because there's always going to be different challenges for those decades of life, and it's always better to be well balanced. So good question, Rich. Hopefully this gives you some good ideas.